Hi, good afternoon, dear teacher, dear partners. I am Michel Chuquimarca. In this video, I'm going to explain approaches that I choose for an ESP course in medicine, like medicine. So, first of all, I beg your pardon, teacher, because I really changed a lot of settings in my camera, so I'm not sure if it's clear for you. I did my best. Maybe it's not a good camera, so I beg your pardon if it's not clear. So let's begin with this explanation. The first part, deciding an English for academic purposes course in medicine involves tailoring the syllabus to meet the specific needs of learners who will use English in academic and professional contexts, in this case in hospitals, in clinics, within the field of medicine. Based on this information provided, here's a proposed outline for EAP course in medicine. The first part is program outcomes. In order to develop the ability to comprehend and produce academic and professional texts in English within the context in medicine, we have to engage language skills necessary for effective communication in academic and clinical settings. Also, we can foster as teachers critical thinking skills in analyzing and discussing medical literature. The syllabus types, I choose these specific syllabus types because as a teacher we have to focus on grammar structure relevant to medical discourse, and for instance presenting cases, studies, writing research papers, using medical terminology. We know there is a vast vocabulary according to medical terminology, so the students must dominate this new vocabulary for them. So the first one is notational and functional syllabus. To emphasize functions such as presenting research findings, discuss patient cases, and engaging in medical situations, we have to incorporate notions such as medical ethics, healthcare policies, and medical advancement. Is a new kind of vocabulary here. For example, in policies, we have to use a vocabulary from law. So it's not just medicine in this case. It's related, but not just that. Next one is skill-based syllabus. Develops specific language skills like reading medical literature, reading case reports, listening to patients' histories, and deliver medical presentation. The next one, the text-based syllabus, is used to integrate tasks such as analyzing medical research articles, conducting patients' interviews, very important to get a good diagnosis, and preparing medical presentations. And the last one is a content-based syllabus, in order to explore medical topics, research methodologies, and case studies to integrate language learning with medical content in one thing. So I expand this part providing module 1, introduction to medical discourse to understand general genres, reading and summarizing medical articles, basic medical terminology. And module 2 is academic writing in medicine in order to craft research papers, developing case reports using evidence-based language. Module 3 is medical communication skills. Patients interview and history is the main part of this module, giving medical presentations and engaging in medical discussions. And finally, the last module of this course is module 4, specialized topics in medicine, ethics in healthcare, current trends in medical research. Very important because a good physician has to be every time actualizing this knowledge. And interdisciplinary collaboration in medicine. Next part, resources and materials. As always, textbooks of medical in English and academic writing to do these kinds of reports. Authentic medical articles and case studies to learn new vocabulary, also experiences using the language. Simulated patient scenarios for role play activities to be confident, the students be confident using the language with real patients, for example, or their partners in the course. Online databases for accessing recent medical research on internet using a vast knowledge on internet, or using AI for doing medical research, could be. Next part, assessment. In this course I'm going to assess reading assignments, for example research papers and case reports. Important to have a good diagnosis, as I told you. Oral assessment, medical presentation, discussions, oral presentations too. For example, presenting the functions of how a drug works in the body, human body. Reading comprehension test of medical literature. We know we have to read in order to write, so it could be a good material, a good assessment, to give this kind of material to my students. And the last part is technology integration. As we know, every field in education in general, as a professional, we have to use technology, so medicine is not exception. We have to implement new technology and new vocabulary about this technology to the course. And finally, adaptability. Regularly review and update the syllabus based on feedback and changing trends in medical discourse, and providing flexible learning pathways to accommodate diverse learner needs. As always, learner needs is the main focus of a course. So that's all my presentation. I thank you so much, and as I told you at the beginning of the video, I beg your pardon if it's not clear. I did my best to improve. I move a lot of settings in my camera, so I'm so sorry if it is not clear. So, thank you so much, and see you in the next video. Bye bye.